I'd love to talk about erections.
If your testosterone is very low, actually, testosterone would be really, really helpful for erections. If it's not that low, it can still be helpful, but it isn't more helpful than the vasodilators like Viagra, which is Sildenafil. Pfizer did a study a long, long time ago about systemic blood pressures, and they thought if we give something that'll dilate the vessels, that'll decrease the pressure. They gave them huge dose, 800 milligrams of sildenafil, and they did their trial, invested millions, and what happened? It worked, but not fantastic. But they noticed, or at least somebody noticed, that the packs from the placebo arm were being sent back, but the packs from the active treatment arm with sildenafil or Viagra in it weren't being sent back. And the reason was they were having fantastic...
Raging boners.
Right, they were having fantastic erections. Okay. And then they dialed back the dose a bit, and that's how Viagra was born.
Do you know that it's also good for period pain, but they just never pursued that avenue?
That's really interesting.
Yeah.
What do you think is one of the problems when a guy takes Viagra? They tell me that I feel like I'm on the clock, Martin. I'm popping a pill and now I'm on the clock. It better happen. I've got to take it 2 hours beforehand, so I've got a plan. And then I feel like, well, gee, I've got to use it. And that's not great in a relationship. What you want is spontaneity. The number one medication I prescribe in my clinic, microdosing of daily Cialis, a thing called. It's an interesting medication. I would think about Viagra as the sticky tape. It's like the Band-Aid. Daily Cialis is a really good medication for men because it decreases their blood pressure a bit. It helps the lining of your vessels. It decreases inflammation. Ian Thompson did a trial in which he looked from now into the future about guys who presented with erectile dysfunction, and that 15% of them within 7 years would end up with a heart attack or a stroke. There's emerging evidence that people who take PD5 inhibitors like Viagra and Cialis have a lower risk of dementia.